afternoon. I would like to welcome the faculty and staff, family and friends, and fellow students of the University of Evansville as we celebrate the Doctor of Physical Therapy program's second annual White Coat ceremony. We are very excited to have the opportunity to continue this tradition in honor of the DPT students here at UE. On behalf of the faculty, staff, and students who have planned this event, I would like to thank you for your donations and support that have made this event possible. Thank you for being here today as we recognize the professionalism and dedication of the DPT students of UE. This ceremony signifies the transition of these students into the professional program. The white coat they will be receiving is a symbol of healing, a symbol of help, and most importantly, a symbol of hope. It is a symbol of their commitment to their future patients and a symbol of their compassion and excellence they will strive for when treating their future patients. Although many of you may choose not to wear your white coats, allow it to remain a symbol of your achievements and a constant reminder of your dedication to the profession and its core values of accountability, altruism, compassion and caring, excellence, integrity, professional duty, and social responsibility. In addition, the white coat represents the progress of physical therapy as a profession. In Vision 2020, the American Physical Therapy Association states that the physical therapist will earn a doctorate level degree, and in doing so, will join rank with the elite 5% of the American population holding a doctorate or professional level degree. Vision 2020 also states that by the year 2020, physical therapists will be viewed by all as primary care practitioners, treating patients without physician referral. This ceremony is progress towards this goal. Last year, Indiana became the 50th state to gain some sort of direct access, which has helped progress physical therapy as a profession towards this goal set out in Vision 2020. The growth and progress of physical therapy worldwide makes this an exciting time to be entering our profession. My hope is that this ceremony will inspire you and at the same time remind you of your duty as a professional. And I'd like to ask you to think about your future as a doctor of physical therapy and the responsibility that comes with it. And now, I would like to introduce Dr. Kiesel, who will be introducing the faculty members of the Physical Therapy Department.
Good afternoon. My name is Dr. Kiesel, and I'm happy to share introductions of our faculty. We talked about this a couple of different ways. We've got a lot of new faculty, and we realized a lot of the students coming in might not have a good idea of what we do and kind of who we are, and they see us in class, and that's about it. And so we're excited to share a little introduction with you today, so I would like to also add my welcome. First is Dr. Robert Katina. Dr. Katina has been with us since 2011, and he is a biomechanist. He got his degree in biomechanics and motor control from the University of Oregon. His primary teaching area is in biomechanics, as you would suspect. He also helps in a number of other areas, including anatomy, and probably his primary role is to manage and be the director of our motion analysis laboratory, where a number of us will be conducting research, and will be going forward. So interesting, very diverse background. Robert, in a short career, has already achieved 9 peer-reviewed papers, and he has also done a number of high-level consulting appointments and spent some time at Harvard University. So we're excited to have Robert on our staff, and he is the lone non-physical therapist. And so we're glad to have a basic scientist with us. So glad he's here. Next is Sherry Chambliss. Sherry is our operations administrator. She, as you can imagine, holds things together for us. She's been with the department for 17 years. She holds a bachelor's degree from the University of Evansville, and as I said, has a tremendous amount of work that she does. I think the students get to know Sherry much better than a lot of the faculty members, particularly early as they work through their program, and she is tremendous to all of us, so thank you, Sherry. Dr. Zurei Chen. Dr. Chen just joined us. It's her first full year here. She, too, received a biomechanics degree from the University of Oregon. Her teaching and expertise area is in neurological rehabilitation, geriatrics, and gait and motor control concepts, and that's her research area. Her entry-level degree She received in her native country in Taiwan, and so we're excited to have her here. She also has personal interests, and I won't highlight the personal interests of many of us. We got a lot of different things. I will say something about Dr. Chen. She indicates music is an interest. She is a very high level, I believe, concert lover pianist, as well as not just being a ping pong player, but a Northwest Regional U.S. champion in ping pong. So we're excited to have Dr. Chen with us. Next is Shawla Cunningham. Shawla gets the award for the most degrees. And I would say, I don't know if it's on here, but she's currently in another PhD program as well. So there'll be one more in the next few years. So Shawla is a seasoned clinician and manual therapist, teaches for a large continuing education group. She teaches a lot of clinicians and runs a residency and fellowship program. So she interacts with practicing clinicians around the country and really a whole group from around the world. So we're excited that she brings that interest and that background into her teaching. Her research areas are in low back pain and medical screening. She's developed a novel medical screening tool which helps advance our profession as we again look toward direct access. She teaches, of course, the musculoskeletal and medical screening areas, as well as medical pathology and pharmacology. As with many of our faculty members, has that personal interest of travel. Next is Mary Kessler. Mary is currently the co-director of the Physical Therapy Assistant Program, Assistant Director of Clinical Education, and as many of you know, Mary spent 17 years as the chair of the entire Physical Therapy Department and just stepped down last year. So she's in her 22nd year at the university. She is a University of Evansville graduate. Teaches in professional clinical issues and neurological rehab for both the DPT and the PTA programs as well. Her research areas in cultural competence, she's done a lot with the students and helped get our pro bono clinic, the ACE Care, up and running. So a number of different awards and accomplishments over the years, of course, for Mary and her contributions to the department. Next is me, Dr. Kiesel. I'm associate professor now. I received a PhD from the University of Kentucky, and my interests in research include motor control and back pain, and then as of late, the last few years, more in injury prediction and prevention. I practice in town in physical therapy, treat mainly back pain patients at Pro Rehab, starting my 14th year here. I guess if there's anything interesting, it would be that I have the unique privilege to teach around the world. I've been taught or presented research in 12 different countries over the last 4 or 5 years. It's been a great experience to be able to really have a sense of what's going on around the world in our profession. Next is Janice Kidder. Janice is our new administrative assistant, just started with us really in the middle of last semester, so she got thrown right into it. She's done a wonderful job. We are very excited to have her here in a busy accreditation year, and she has a degree from Southern Indiana. Next is Tink Martin. Tink is a full professor at the university and has been here for 30 years. She's starting her 30th year. She's starting her 33rd year as a physical therapist in town at the Easter Seals Rehabilitation Center, working with pediatric pediatric physical therapy. She is nearly complete. She has nearly completed her PhD in rehabilitation sciences from the University of Kentucky. That's the ABD. That's all but dissertation. And she has a number of other degrees. And it looks like she's got some basketball conflict during the Final Four time. And she's done a lot for profession, as you can see, including the president of the section of pediatrics for the whole association, APTA, chief delegate and delegate of the Indiana chapter for APTA, and a number of awards. So Tink is truly committed to the profession and done a wonderful job. Joni McPhilia. Dr. McPhilia is an assistant professor in her 6th year with us. Her degree, her PhD is in health services research from Old Dominion, so she has done a lot with our research classes and research and evidence-based practice classes, and her patient specialty is also pediatrics, so she also works with kids at the rehab center and has an interesting research background looking at specifically quality of life of kids and families with developmental disabilities, and is currently doing a number of different things at the department level. I think she's contributed, as we all work hard, but she's done a wonderful job, as you can see, all the different activities that she's taking on, including a number of committees and task force work. So we thank Joni for that. Next, Dr. Phil Pliskey. Dr. Pliskey is a graduate of the University of Evansville. He received his doctor's degree from Rocky Mountain University in 2007. He's also a board-certified orthopedic specialist. He is at his fourth year full-time teaching, but he's done some adjunct and part-time work with us over the years, so he's been around the program much longer than that. He's also the director of the sports residency program, a joint program between the University of Evansville and Pro Rehab in town. Over the last, I guess, 5 or 6 years now, we've had a number of residents come through, and excited that all of those residents have passed their boards, and has got a wonderful program there. He also practices physical therapy, Pro Rehab, and his research interests involve injury prediction and prevention, fall prevention with athletes, and has done a lot in the military. He's got a large study that he's involved with looking at injuries in soldiers, and that's in its final year. So Phil's very busy with that and consulting with a number of military groups, including the U.S., Israel, and Canada, so really interesting there, as well as a number of professional sports teams. He's a busy guy with four young boys, so glad to have Phil with us. Next is Jan Sapanski. Janet has been at the university now for 20 years, in her 20th year. She too is a graduate of the program, and her area of expertise is in neurological and geriatric rehab. She is a geriatric clinical specialist. She works in town here in an inpatient rehab facility. And one of the main thing Jan does for us here is provides the clinical education coordination, which is a very, very big job, and students will get to know Jan quite well through that, as you can imagine, in terms of coordinating all the clinical sites and the time that they're off campus. She's also very involved at the national level, where she is a trainer to teach clinical physical therapists how to be good mentors, essentially. So she is very active at a number of levels. Next, Frank Underwood. Frank is a full professor and currently the department chair. Frank has a diverse experience in physical therapy and research, including 20 years as an Army physical therapist and educator. He's taught a number of different areas within the program. He really designed a number of different portions of the curriculum, including the evidence-based practice and scientific inquiry component right now. He continues to practice clinically, doing electrophysiological testing in town. That's a unique area for physical therapists to work in. He's done a variety of different research projects and published almost 30 peer-reviewed publications. He's also chaired a number of chaired or been a member of a number of committees of PhD or doctoral students, and I'm happy to say that I was one of those students that he helped along, and has committed a lot of time and support and mentoring to me and others, and so we definitely thank Frank for that, and then all of his work at the national level with exam item writing and several other components. So we thank Frank for that. And Dr. Yuri Yoshida. Dr. Yoshida is assistant professor with us. She has her biomechanics degree and PhD from the University of Delaware. She's starting her second year here. She teaches in modalities and statistics and basic patient care items, and she has a very robust line of research, which includes right now looking at total knees, so knee arthritis patients, looking at improving protocols for post-op total knees. And she spent time at the University of Utah 3 years on a postdoc learning those methods, so she brings a variety of interests and a variety of research experience into the faculty. Thank you.
And now I'd like to introduce our keynote speaker, Dr. Underwood.
Hi, I'm Frank Underwood. As you saw up there, I'm currently the chair of the department for at least this next year. So, good afternoon. Thank you for taking the time to be here today. I do realize that for some of you, your presence here wasn't really optional, but thank you for being here anyway. I'd like to acknowledge the efforts of Lauren Ellerman, Tanya Behringer, and Allison Weaver, who, with the tireless input from Dr. McPhilia, organized this entire ceremony. So let's give them a I was asked to speak a bit about professionalism, ethics, and some other aspects of the transition from pre-professional to professional education. Now, I do believe these aspects will be a part of the talk. It seemed to me that going head-on into those topics would seem too much like a lecture, and I don't think any of you are ready for that today. That comes tomorrow. There are 3 ideas, however, I do want to address. Then I'm going to start with a quiz. All right. Together, a ball and bat cost $1.10, and the bat cost $1 more than the ball. How much did the ball cost? Okay. Second question. An individual has been described by a neighbor as follows. Steve is very shy and withdrawn, invariably helpful, but with very little interest in people or in the world of reality. A meek and tidy soul, he has a need for order and structure, and a passion for detail. Now the question is Steve more likely to be a librarian or a farmer? Now these are pretty simple questions. If you answer that the ball costs a dime, then you would have answered the same as the majority of the thousands of people who have been asked that question. But you would also be incorrect. If the ball cost a dime and the bat was $1 more than the ball, then the bat would cost $1.10. So together they would cost $1.20, not $1.10. The ball must cost a nickel. So together a bat at $1.05 and a ball at 5 cents would be $1.10, right? Okay. Now, if you answered that Steve is a librarian, you could be correct, but it's not likely. In the United States, there are about 156,000 librarians, most of whom are women, but there are over 1 million farmers, most of whom are men, right? So though the description of Steve may fit what our bias thinks fits more with a librarian, the probability is that Steve is a farmer just because of the proportion of farmers compared to librarians. Okay, so what's the point of the quiz? Well, if you answered that the ball cost a dime and that Steve is a librarian, you were using a thinking process sometimes called fast thinking or intuitive, going with your gut. To consider the entirety of the question and come up with a nickel and a farmer requires what is called slow thinking or logical thought. In many areas of our life, fast thinking is good and can help us survive. If you're crossing Walnut Street and logically think that the driver of that car that's coming down will see you and will yield the right-of-way, you may well not survive. If you see that car and react quickly, believing that the car represents danger and you should therefore wait, you will survive, at least assuming the car stays in the street. Intuitive thinking will also serve you well as an experienced physical therapist. But now at the beginning of your career as a physical therapist, you must think more logically and consider information other than what is contained in the question being asked. And that requires slow thinking. Okay, need a prop here. This is the text that you will use in the pathology course taught by Professor Martin. Now, if we look in the index, and yes, I've already done this, I even marked it, there's no entry in this index with the word health. Health doesn't exist, right? At least it doesn't in this text. Now, obviously, that's a fallacy. Health does exist. What it means is that the point of this book is to convey information about pathology. It describes what goes wrong, not what goes right. Now, think back to all of the papers you've written in your academic career to this point. How many of them will return to you with more comments telling you what you did right than what you did wrong? That number probably approaches 0. Now, how many of those papers earned you a grade of D or F? Likely very few, if any, earned anything less than a B. So how do we reconcile the fact that there were more negative comments than positive comments, but you still earned a good grade? Well, the feedback you receive from the faculty is intended to help you improve. And the only way to get better is to know what wasn't done right. We honestly do try to give you positive feedback, but that good feedback is often in the form of a grade, not in the comments. So don't be discouraged when you receive a paper with lots of comments about what you did wrong. Consider it a compliment that the faculty are so concerned with helping you improve that the time was given or taken to give you that specific feedback. Third point. A few moments ago, I used the phrase, now at the beginning of your career as a physical therapist. You may think you are at the beginning of your education to become a physical therapist, but in reality, you are truly at the beginning of your career as a physical therapist. That's the primary point of this whole ceremony, to draw a clear, bright line between your time as a university student in an undergraduate or a baccalaureate program and what you are now, a student physical therapist, truly a part of the profession. The expectations of a professional are very different from what you may have been used to, and our expectations of you are not because we, your faculty, are trying to be mean or that we lack compassion. The high expectations begin now so that you will be accustomed to them when you are in the clinic, interacting with patients, clinicians, and all of the other folks involved with delivering health care. Now, it may have been acceptable in the past to skip class so you could get a nap or to nap in class. Not now. It may have been acceptable to ignore some detail in the directions for assignments in the past. Not now. It may have been acceptable to be a few days late getting something done in the past, and not now. If you do not obtain your immunizations, your TB tests, and everything else on time, your failure to behave professionally will have a negative effect on many people who are trying to do a good job. Now, all of these expectations translate into patient care, though you may not see it at this point. Being late in treating that patient with a wound may lead to an infection that is fatal or results in an amputation. Skipping that session with a patient may result in that patient never being able to return to work. You need to trust that everyone involved in your education truly wants you to succeed, wants you to become an expert physical therapist, and truly will be wounded if you do not. So that's it, my 3 points. Think slowly, meaning logically. Take comments about how you can do better as a good thing, and be professional in all you do from this moment on. All of the ingredients are here, the faculty, the staff, and you. By May of 2016, a scant 32 months from now, you all will be novice clinicians, but seasoned professionals. Thank you for your time.
And now for the presentation of the white coats. Students, if you'll take your positions, please. John Bolenbaugh. Shannon Dick. Emily Jolly. Kelsey Schmidt. Amy Gordon. Kendall Couts. Alexandria Hayes. Matthew Hamilton. Brittany McCall. Jesse McKenna. Ryan Nelson. Brittany Shaner. Alyssa Waniger. Alex Weinzapel. Ashley Will. Veronica Asher. Sarah Johnson. Paige Knott. Melissa Cripps. Joshua Lee. Andrea Weber.
Lauren Alexander. Samuel Cartwright. Jessica Dodgett. Jessica Cohn. Jared Maslin. Jacob Miller. Kara Strevert. Jennifer Zuckerman.
Joseph Downing. Ashley Edwards. Siobhan Gudat. Jennifer Kelly. Matthew Kramer. Audrey Lynn. Kelsey Schluter. Emily Schultz. Samantha Neidig. Camille Fetzer. Stephanie Thompson. Jenna Heinrich. Haley Jones. Rachel Tinhuer.
At this time, will the students please join me in reciting the Code of Ethics for a Physical Therapist? Physical therapists shall respect the inherent integrity in themselves. Physical therapists shall be trustworthy and compassionate, addressing the rights and needs of patients. Physical therapists shall be accountable for making sound professional judgments. Physical therapists shall demonstrate integrity in their relationships with patients, families, colleagues, students, research participants, other healthcare providers, employers, payers, and public. Physical therapists shall fulfill their legal and professional obligations. Physical therapists shall enhance their expertise through lifelong acquisition and refinement of knowledge, skills, abilities, and professional behaviors. Physical therapists shall promote organizational behaviors, business practices that benefit patients and society. Congratulations to Doctor of Physical Therapy students. Let this white coat be a symbol of your achievements and constant dedication to the physical therapy profession. Thank you, faculty and staff, for your continued support, which has made the second annual event possible. Thank you also, family and friends, for your love and support of these future Doctor of Physical Therapy students. We'd like to invite family and friends to join us for a reception outside the room. Students, if you could remain close to the stage, we're going to take a class picture and then you'll be free to join your family and friends. And if you would like individual photographs taken, we have student photographers that will take them for you in the back of the room. Thank you.
I still get emails from Rod and Bob.
I like to use. Yeah, that's pretty cool. Trixie has some relatives there that I